Von Willebrand disease, VWD, is a bleeding disorder that affects the blood's ability to clot properly. It happens when the body doesn't make enough von Willebrand factor, a protein that helps blood platelets stick together to form clots and stop bleeding. Without enough of this protein, bleeding can last longer than normal. Unlike hemophilia, which mainly affects males, VWD can affect both men and women. It's usually inherited, meaning it's passed down from parents, though some cases can develop later in life due to other medical conditions. There are three main types of VWD. Type 1 is the most common and mildest form, where the body makes less von Willebrand factor than normal. Type 2 means the protein is present, but doesn't work correctly. Type 3 is the rarest and most severe form, where the body makes little to no von Willebrand factor, leading to serious bleeding problems. The severity of symptoms depends on the type of VWD a person has. Symptoms can vary from mild to severe and may include frequent nosebleeds, easy bruising, heavy or prolonged bleeding from cuts, excessive bleeding after surgery or dental work, and in women, very heavy or long menstrual periods. In severe cases, internal bleeding in joints or muscles can occur, similar to hemophilia. Some people with mild VWD may not even realize they have it until they experience unusual bleeding after an injury or surgery. Diagnosis involves blood tests that measure clotting ability, von Willebrand factor levels, and platelet function. Because symptoms can be mild, VWD is sometimes overlooked until a person undergoes surgery or has a significant bleeding event. If there's a family history of bleeding disorders, doctors may recommend testing even if symptoms are not obvious. Treatment depends on the type and severity of the disease. For mild cases, treatment may not be needed, but in situations where bleeding risk is high, medications like desmopressin DAP can help the body release more von Willebrand factor. In more severe cases, clotting factor concentrates containing von Willebrand factor may be given to prevent excessive bleeding. Other treatments, such as antifibrinolytic drugs, can help slow down the breakdown of blood clots. Women with heavy menstrual bleeding may benefit from birth control pills, which can help regulate bleeding. Managing von Willebrand disease includes avoiding medications like aspirin and nonsteroidal anti-inflammatory drugs, NSAIDs, which can worsen bleeding. People with VWD should inform doctors and dentists about their condition before any medical procedures to ensure proper precautions are taken. Wearing a medical alert bracelet can also be helpful in emergencies. While there is no cure for VWD, with proper management, most people can lead normal lives without major complications. If you have a history of excessive bleeding or bruising, getting tested can help you understand your risk and find the right treatment to prevent serious bleeding issues in the future.